Hello ladies and gentlemen, and welcome to this video podcast from Vetstoria. My name is Morko Pienaar. Pet owners occasionally self-medicate their pets with human painkillers. Those medications, called anti-inflammatories, are not designed for use in dogs and cats, and a minimal human dose can poison a pet. Cats especially seem to be very sensitive to painkillers. We'll start by describing the toxic effects of the most common ones: aspirin and ibuprofen, and then talk about the special case of paracetamol. Aspirin and ibuprofen, amongst others, can poison your dog and cat. These painkillers are widely used by the human population and are present in the medicine cabinet of most households. Pet owners sometimes administer anti-inflammatories to their pets without realizing that they're actually poisoning their friend. The problem is that animal dosages are much lower than human dosages. Inappropriate use will trigger the development of stomach ulcers, and this is particularly true in a sick patient or one receiving other medications. These painkillers decrease the mucus production in the stomach. Without its protective mucus, the stomach wall is very vulnerable to the acid contents of the stomach, and bleeding ulcers may develop. In addition, these drugs decrease the blood flow to vital organs, particularly the kidneys, which can result in significant kidney damage. They may also cause bleeding disorders. The most common symptoms are of the gastrointestinal effects, such as a loss of appetite, abdominal pain, nausea, vomiting, and black tarry stools, which is the color of digested blood. They also make the pet pant excessively, and they may trigger neurological symptoms, including restlessness, anxiety, and a lack of coordination. Following the initial illness and gastrointestinal signs, acute kidney failure may develop. This is a life-threatening condition which is extremely difficult to treat. In people, the ingredients of a paracetamol tablet are broken down by the liver. For that reason, paracetamol is generally a very safe and useful painkiller in people. The situation is very different for our pets though. Cats especially have far more difficulty to metabolize the drug. As a result, incomplete breakdown results in dangerous products circulating in our pet's bloodstream. They damage various organs, the liver and red cells being most frequently affected. Symptoms begin within hours of ingestion, and this includes drooling, vomiting and diarrhea, abdominal pain. The gums become blue, the patient is weak and it struggles to breathe, and the urine usually gets quite dark. The patient may usually die within a few days. I would like to stress that paracetamol is a very toxic product to cats, and one tablet is enough to kill a cat. Some ibuprofen tablets are coated with sugar and appeals to dogs. However, on most occasions, the owners are responsible for administering the product. The aim of this podcast is to make sure that you understand the threat of self-medicating your pet. It may be that one night your pet needs pain relief and you might have aspirin in your cupboard. Well, please call a veterinarian for instructions on what to do. Believe me, if aspirin is indicated, your vet will be delighted to advise you over the phone without having to see you in the middle of the night. Finally, we talked mainly about the risks of human painkillers. Very similar intoxication occurs following excessive doses of veterinary licensed painkillers. Here again, the best preventative care is to give your dog only medications as directed by your veterinarian. And remember, more is not necessarily better. Also, make sure you store your pet's medication in a safe place. Some tablets are developed specifically to be tasty and attractive to pets, and if they can reach them, dogs will often eat a whole container of tablets when they get hold of it. Well, that concludes today's program. Thank you for listening, and remember to check out vetstoria.com for further video podcasts, and feel free to leave any comments or suggestions for future topics. Goodbye.